Hey guys, Dr. Anderson here, and I'm here with Deb, who's agreed to speak, but she doesn't be on video. She's a really nice lady, and but I really appreciate her volunteering because I needed a foot model. Thank you, Deb.
You're welcome. You're welcome.
So we're going to be talking about arthritis in your foot. Now, arthritis happens in lots of body parts as you get older, and but in the foot itself, surprisingly, a lot of you think you have arthritis in certain areas, but you really don't. But one of the areas that's pretty common as you get older is in the midfoot area, and that's this area up here. These bones are called the metatarsal bones, and these are bones that we bear weight on. As you go up to the midfoot area, there's multiple little cube-shaped bones called tarsal bones. These are the metatarsals. Those are the tarsal bones, and usually the first or the second and the second metatarsal and the second cuneiform bone, or the third metatarsal, third cuneiform bone, those joints that are formed by those two bones become arthritic quite often. And you'll see when people come in, there's almost like a little bump there at the top of the arch. If there's a little prominence there, and you have that and you have pain, really good chance there's arthritis in those joints. So, and that's what Deb came in with. So, very difficult for her. Like when you're standing, if you put all your weight on one foot and then try to push your heel off the ground and you get pain in that area, that's a little thing that you can do at home to see if maybe you have arthritis in those joints. And that would be like me just standing here and I put all my weight on my left foot and I'm pushing my heel off the ground. And if you get a bit of pain in that area, you shouldn't have any pain. But if you have it, then that's an indication you may have that kind of joint pain. So the point of this video is, what do? We have some unique ways of treating that kind of joint pain here at Anderson Podiatry Center. The main thing that's always been customary in our practice in podiatry as foot and ankle specialists, most podiatrists generally will recommend orthotics for treatment using a custom-made insert in the shoe. And Deb, you've been wearing that for about 2 weeks, right?
2 weeks.
And right. You're probably like 80-90% already, right?
Already, yeah.
So she's doing really well. So her treatment may begin there and end there because she's doing super well just with orthotics.
Right. And
many people respond really well with just orthotics. So what are the other things that are done now? If you're going to kind of a more conventional podiatrist, a lot of them will say, man, if it's orthotics don't help, and we worked with you with the orthotics, one of the other options is going to be we may have to fuse those joints. And I used to have to do that years ago, probably over 20 years ago. It was not that uncommon. If everything else failed, especially your thighs failed, you went in there and you fused those joints. Did it work well? Yeah, it worked pretty good, but you had to be off weight bearing for like 6 weeks. Long layup. So what we have nowadays, there's two other options I want to talk about. Number one, after the orthotics, if you need to, and sometimes you do it in combination with the orthotics, we do regenerative medicine. I've been a big advocate of this. We've been doing it for 18 years. We can inject into that area a stem cell product. These are basically something we get from labs, through FDA regulated labs. Mothers donate the placenta. Right now we're using what's called Wharton's jelly. That can be injected in those joints. And it works really well because these are not load-bearing joints like a knee or hip. They're horizontal to the ground, not vertical to the ground. So people do really, really well with stem cell injections in here. In those joints, you walk right afterwards. It's something we usually do in the clinic. So that's one thing. The other thing we do, at the end of the day, if everything has failed, instead of doing the joint replacement, we can actually come up into her leg. If you look at where I'm at, usually this area is supplied by a little nerve branch up here called the deep peroneal nerve. And we do what's called joint denervation surgery. And so what that means, these are sensory nerves. There's about 4 of them around your leg. And the one that seems to be most commonly worked on is the deep peroneal nerve. It supplies those joints. And by us going in, we make a little incision in your leg, go in, find that nerve branch, and we basically take a section of the nerve, we remove the nerve, and we bury the end of the nerve in muscle so that it doesn't create what's called a stump neuroma. But that works very well for many patients. Very little layup time. You're usually just in a removable cam boot for about 10 days, and maybe keep weight off of it for about 4 or 5 days, and you're good to go. So those are the ways that we can avoid joint surgery for, or I should say, fusion of those joints. So again, orthotics, number 1. Number 2, stem cell. Number 3, forget about fusion. We don't need to do that, at least here. Instead, we go in and remove the nerve, a lot less layup, probably a lot less complications. So something to think about if you have this kind of joint pain in the midfoot. A lot of people don't even talk about it. I'm not sure why you don't hear a lot more about it, but it's a really common problem out there. And a lot of you folks don't even know you have it. But that's, again, if you don't know, but you're wondering if you do, maybe just rise up, put all your weight on one foot, and push your heel off the ground. And if it hurts in that area, there's a pretty good chance you have it. And that's basically it. So appreciate you volunteering.
Absolutely.
And
thank you so much.
You would look nice on camera, but that's okay.
You know what? Thank you for suggesting, and the orthotics are working. I'll be
really
back
good.
if it doesn't, but the bump is going down.
Yeah, the
swelling is going down, and the range of motion is amazing. It's almost normal.
Awesome.
2 weeks.
That's a great way to end the video. I think we should stop. That's a good way.
Thank you.
We really appreciate it. But she's a success example of just how orthotics all by themselves can do a good job for you. So anyway, thank you for watching, and please consider subscribing to our YouTube channel.